Hello, hello. This is Jay from LifeRx Wellness, and we here in our clinic, and we're gonna do a little conference with our lymphatic drainage therapist. Look at those beautiful girls. This is Marina from my left side, Miranda, Laura, and Yana. And we guys want to answer your questions. There's so many questions. What's the lymphatic? What's the benefits? When you can do all that kind of questions. So we want to answer these questions. And the first questions: what's this? The post-surgical lymphatic massage. And
Okay. So, a lymphatic post-surgical care is a specific type of massage therapy that specializes on the healing process after your surgery. It really helps to reduce the swelling, it helps to reduce your pain and maximize your results while also promoting the natural detox throughout your body.
all right, great. So we know what's the lymphatic drainage massage. Now we're going to tell you what exactly we can do in our clinic. And people coming with liposuction recovery, this is what we do. This is really, really successful treatment for us. Also, we do BBL. We're doing breast reconstruction. Is that correct?
Breast augmentation, tummy tuck, and lipo recovery.
Can you say that?
We focus on lipo, tummy tuck, breast augmentation, mommy makeover, and tummy tuck recovery.
This is how we can help you. And most benefits of all this lymphatic drainage massage is to remove edema, swelling, scar tissue, and get the smooth recovery. This is the main idea. If you spend so much money on that precision, and recovery is important, and it's number one, because we see a lot of people coming after the surgery and they not done any lymphatic drainage therapy, and let's say the result is not is the best. So we highly recommend to do lymphatic drainage massage for all this plastic surgery post recovery. So tell our clients how's that work, what's the magic, and how they can help, like your hands can help them.
Okay, the therapist uses the techniques and gentle massage with the fingers and hands, and they increase the healings. It's very good for the clients and reduce the swelling and helps the reduce inflammation in the body.
Okay. I got another question. So people calling and they said, how fast I can jump on that table and release that like swelling. Let's say I done like a tummy tuck day ago. So is that good for me to go do this lymphatic massage? Who can tell the clients when they have to do this lymphatic therapy?
Usually it's depend of what the doctor says, because every surgeon might advise you different time. Some might say it's okay to do lymphatic after let's say 2-3 days after the surgery, but might ask you to wait for a week or even 2 weeks. So you have to always consult with the surgeon, with your doctor, and listen what they say.
All right, I think it's a fair, but yeah, usually it's like 2 days, and most cases. But like Yana says, it's yes, you have to go to this surgeon and doctor. Okay, let's say people ask me the questions. I'm drained a lot, so that's mean that the fluid is coming out. What do you guys do in this case? Who want to answer this question?
So while your fluids are coming out, it depends if you still have your drains in or not. If you still have your drains in, what the therapist is doing is if they're coming to your home, then all we could do is regular manual lymphatic massage. That's where they're using light, gentle strokes on the body to help release the fluids and push towards the lymph nodes and around and circulating around the lymphatic system. That really helps with draining the fluids more, and you're also going to be using the restroom a lot more. Sometimes you might even sweat the toxins out in certain areas. So what we would do is we would if we're coming over to your house as a client, then we're going to massage the affected areas, and you might drain out of those areas, but we're very well equipped. We come with our gloves, we come with pads and everything to help the draining. But you are definitely going to drain, and it's completely normal for your fluids to come out of the body if you still have your drains in.
Okay. Yeah, it's a lot of people call us after the sessions. I am not doing lymphatic massage. I'm doing a different technique, but people call and they said really good feedback. I feel much pain free. It's released the pain at least like a 30%, and people can sleep. Not take that painkillers, and it's helped them a lot. So it's one of the reasons to do this lymphatic drainage massage. Okay. What about infection? So what do you guys do to prevent any, is that easy to get infection during the lymphatic drainage because you touch the skin and it's open wounds kind of stuff? What do you guys do in this case?
So if there's open rooms, the therapist must always have gloves on. We never perform without having gloves on, because if there's an open room, then we have to make sure that we're well equipped for our part as well. But if there's open rooms, like if there's a tummy tuck, there's often times that there might be a rip or something. That's completely normal. It's highly recommended to go to your healthcare provider to make sure that everything is fine. We as massage therapists, we don't focus on the rips. Where our main focus is lymphatic drainage. So we can't focus on any tear or rips that may happen. That's for your healthcare provider to help you with.
Okay. All right. Is any pain during the lymphatic massage? Is that painful? Is that massage painful?
No, this massage is not painful. It's a relief from the pain. So we provide the light techniques to these massages. So it's not supposed to be painful in most of the cases.
All right, I think it sounds fair. And another question: how many sessions you think to see good result and the benefits of this? Is that could be through the one session or two sessions? How many sessions we need?
Okay, so it's hard to say how many times each person will need to do the lymphatic massage, because everybody is different, the surgery is different, and it might need from 6 session to 12 session. All depends of the surgery and body type.
I like to recommend, so that you get a clear idea on how many you might need. The therapist, it's hard to recommend on exactly how many, because even then you might even need more than 6 or 12 sessions. So I highly recommend in the beginning, for the first 3 months, it's recommended to get 1 to 2 sessions per week for the minimum of the next 3 months. Getting surgery is something that you're going to need to really think in the future, because it's a minimum of 3 months, but it could go as long as 6 months as well too. So it's up to you to really search your information and see what you're getting into, because it could be quite a process.
Okay, and the price is we do 2 services. We go in your house, and you can come to the clinic. It's $147 for lymphatic manual therapy, and if you would like to use the machine with Miranda, she's only specialized in that. You can it's charging $187. She's going to talk about this in a minute. So also we do in-house calls, which is $217 and $207. It depends on area. And we also have packages of 6. You can start with package of 6 and save $20 on each session. So more details in link below, so you can guys click and learn about our prices. So the next questions I do have is that insurance cover lymphatic drainage massage?
So unfortunately, the insurance doesn't cover, so the patient has to pay.
But listen, if you get, it's always ways around, and if you figure out your surgeon can do something about it, or your doctor, it was always good. Always check with them. But we are not working with insurance. This is unfortunately, yes. Okay. So people ask, is any side effect of lymphatic drainage massage?
There is no any side effects. The only side effect is reducing uh, pain and swelling, and it is helping with the pain. The client will feel easy with their movements and recover more quickly.
I think it's the only bad side effect. You guys gonna pee a lot and drink a lot. That's what the thing is. Okay, people ask, can I do my sport activity after lymphatic drainage massage and post surgery? And let me answer this question. You have to talk to your surgeon and see what's your scar is and how's the swelling. But I'm highly not recommend if you've been doing breast reconstruction and you try to do, I don't know, weightlifting. It's not a good idea. So, you want to add something?
Yes, about breast reconstruction. If you had this type of surgeries, so most likely your surgeon will give you advice not to do any sport activity for 3 months at least.
So yeah, recover smart, be smart about your body. And like I said, for the best result, you have to do lymphatic manual drainage therapy. And this always work. We have really good feedback from our customers. And now the Miranda is going to talk about this machine and what she's exactly doing with this machine. So she's only provided service inside the clinic. It's not for the house calls, okay?
Yeah, so like Jay said, this service is only here for the clinic. I'm a lymphatic drainage massage specialist, but I specialize for a more advanced lymphatic drainage massage. So a lot of times when getting out of surgery, even regular manual lymphatic drainage is not enough to get rid of the hardness or the swelling or prevent fibrosis from happening. So a lot of times I like to use more of an advanced technique, which is ultrasound. Ultrasound is a light technique, it's a light technique that I use, still manipulating the lymphatic massage, but it sends tiny little ultrasonic vibrations to really help drain the fluids from your body as well. It helps reduce the swelling, it helps break down the fibrosis, and prevents seromas from happening as well too. Throughout the sessions with me, I use different techniques like light cupping, dry brushing to really help heal the skin as well. You go through a bunch of different stages. There's 3 different stages when going through post-op care. So I have a lot of information from that, and I use this machine like ultrasound and light cupping to really help maximize your results. This is only here in the office, and we're located here in Glendale, California.
And just remember, it's not just for the post-surgical, it's also great for your immune system, especially right now with the COVID, with all these viruses. This is really, really good technique. Also for the hormones, if you got hormones problems, the lymphatic drainage is the number one. So take care of your body. If you need help, any kind of help, immune system, post-surgical, or the hormones, or just relax. It's also great relaxation kind of technique for relax and stress related therapy. So give us a call, book this beautiful therapist, and enjoy your sessions. We can come to your house or clinic. Bye-bye.